All right. I would have thought for many people in Washington, they'd rather not say these three words again, but yet again we are. Healthcare reform. Since the Supreme Court decided to keep the law on the books, at least in the main, we haven't heard a lot about Obamacare, except as an applause line when anybody who's running for office on the Republican side says repeal and replace. Well, today, the other part of Obamacare is in the news, the part that actually does something you can get your hands around, improves health care when talking about for millions of Americans, right?
And access to health care, Rich, and all these new benefits are aimed at improving women's health, including benefits that insurance companies must now provide for free.
Over a month after the Supreme Court upheld the president's health care law, today marks another milestone in its implementation.
Thanks to the Affordable Care Act, a new day for women's health has finally arrived.
Today, the Women's Preventative Health Care Amendment goes into effect. 8 new provisions under the president's health care law that the Obama administration says will help women get the basic services they need.
Surveys show that more than half of the women in this country delayed or avoided preventive care because of its cost. And that's simply not right, and it's not good for our country.
The top killers of women will now no longer go undetected.
Getting the most attention today is the provision that requires private insurance companies to provide women free access to contraception. The Obama administration estimates that about 47 million women will be able to take advantage. But just a tiny fraction will be able to do so starting today because of complicated grandfather clauses for many large employer insurance plans. As Democrats touted the benefits of these new provisions, Senate Republicans kept up their drumbeat.
I think it would be appropriate to have a vote on the repeal of Obamacare.
The expectation is that the new benefits will make the reform law more popular and perhaps balance out some of the split opinions of the law that we're getting from voters. When asked if they support reform or Obamacare, more people still say they oppose it than support it. But when you ask about specific provisions within the law, a majority of Americans support most of them, like closing the Medicare donut hole, keeping kids on their parents' insurance until they're 26, or banning higher rates for women. Rich?
All right, Andrew, and in keeping with the theme here of there's stuff that's actually happening, it's not just partisan debate here, we're going to scroll some of the benefits that are already now in place, beginning to roll out, or will by 2014. All right, Dominic, I'm going to ask you the politics as people are looking at this. I'm conflicted on this one because you say Obamacare, no matter how you want to phrase it, right, and there's a visceral reaction, but everybody agrees, even his opponents, he didn't sell this thing the right way. He uses political capital to pass the thing, but he never explained to people what they get in it. It's too complicated to do in a bumper sticker. Is it smart this time around if he tries between now and November to repitch it?
That's a risky argument, a very risky one. All I can tell you is the jury is still out on Obamacare, your words, Obamacare. We don't know. History, I have a funny feeling, will say he will go down in history as one of the better presidents solely based on Obamacare, if you're asking for my prediction. But right now, in the middle of an election year, the argument has been framed effectively by Republicans that it's going to cost you more money. Hey, Joe American, you got a job. This president, who some say is a socialist, whatever, he wants you to pay more money. So I don't know if I'm Obama, if I want to go around America selling that. And he's taking away your choices.
I'm not sure that the Republicans frame that. I think the American people frame that. You know, I hope that they've read the bill now. You know, I've tried to read the bill. I've read through it. I still don't understand all its parts. The thousands of pages, plus the tens of thousands of rulemaking. You went down the list of all the benefits. I want to see all the costs. Let's go down the costs that were deferred by years. We're very cynical electoral politics. Let's go out and roll out these benefits on election year, let's defer the cost to the next president.
But nobody ever talks about the cost of the status quo, the fact that insurance rates keep going up, the cost that health care keeps going up, and that nothing that's being proposed by the Republican Party would offset that or change that in a dramatic way whatsoever.
Andrew, believe it or not, I agree with you that it is incumbent upon whoever wins this election to come up with a market-based solution that will work. What's clear is this will work.
But we have a market-based solution. We've had, or a market-based system. We've had one since the early 70s, and that's when we've seen the spike in rates.
I would argue,
and that's when we've seen the drop in
coverage.
You two
argue in the break here. Keep going as we do this.